Part 2 of Child Abuse and Neglect is about assessment. Some of the things that you're going to look for are going to be the psychological component, the physical component, as well as considering is there neglect. So a child that is dressed unsuitable for the weather or the season, a child who's not able to concentrate, so he's hyperactive, or is complete opposite, completely apathetic, just sits in a chair, doesn't want to listen, doesn't want to participate. Parents, what you're looking for here is, do they appropriately supervise the children that they are responsible for? And another thing is, do they identify and notice conditions that can be dangerous to their child or activities the child is engaging in that are also dangerous? The physical components that you're looking for is hygiene practices. Do they smell bad? Is the skin dirty? Is the hair dirty and stringy? Does the child always have dirt under the nails? Is there ever a time that you see the child that they're actually clean as they should be? Look for bald patches on the back of a head of a young baby. Remember, they can't get themselves up, and the parents are supposed to be holding and cuddling this child as well as playing with them. But when they just leave them in the bed and the baby continues to move their head against the sheet, then they lose that patch. Additional signs can be failure to thrive. We'll talk more about that in the GI lecture. They can also have nutritional deficits. Look at their skin. Do they have infections? Do they have rashes? Do they have abrasions? Then, of course, there is medical neglect. And what this is parents who don't bring their child in when they're supposed to. So they wait till the very last minute when the kid is gasping for air when they are an asthmatic. A diabetic type 1 is continually coming in for ketoacidosis, and they're lacking the usual follow-up care. Emotional abuse is really hard to assess. Psychosocially, are they acting withdrawn? Do they seem to be depressed to you? And then the other side of that spectrum is always wanting to get the attention, disruptive, hyperactive, and aggressive. Do they have habits like sitting on a chair and constantly rocking back and forth, sucking on things? Are they biting things? These can all be signs that this child is trying to reach out and tell us that there's something wrong. Sleep disturbances can be a sign of emotional abuse. And then as the child gets older, they may exhibit signs of obsessive compulsive disorders. They can have the phobias as well as profound anxiety. And we're not just talking anxious because you're next in line to give a speech or to take a test, that type of thing. This is an anxiety of being around other people, especially adults. Do they have learning disorders? Are they developing appropriately? And if not, is there something physical that's going on that's leading to this? Or is it strictly the environment? And once again, this rolls into our failure to thrive. How is their speech? And not only is it developing correctly, but what kind of words are coming out of the child's mouth? Physically, the failure to thrive, as I've mentioned, but then when we get into our school-age children and our adolescents, we start seeing self-inflicted wounds, self-mutilation. So the cutting behavior, I already mentioned about some kids that I've taken care of that were trying to thread sticks up their veins and paper clips. In addition, they may have signs of sexual activity long before they ought to, and they might be coming in with STDs. Out on the playground, is this child always isolating himself? And this can also be sitting in an exam room or a waiting room. There's other children their age that are playing and they lack any interest at all in joining in. A sexual abuse assessment requires that you be on alert that it's happening, but when we actually have a child that we think is sexually abused, we do a complete forensic exam, and it takes a special nurse practitioner physician to complete it because this case is going to go to court. But red flags may be Once again, social isolation and depression because they don't want to be engaged in this type of behavior. Running away, not performing well in school, bizarre behavior, very promiscuous behavior considering their developmental level and their age. We start seeing eating disorders, anorexia, bulimia, and the onset of obesity, because after all, if I become obese, I'm no longer going to be attractive. The parent might be coming in complaining that the child has sleep disturbances, waking up with nightmares. They're locking their bedroom door and they don't want to allow adults in. We don't really know who the perpetrator is at this point. Is this child reaching out to substances to block away their memories? And then, unfortunately, some of these children start having suicidal ideations and they will make an attempt. And this is their desperation to get away from the environment. Physical signs of sexual abuse will be repeated UTIs as well as STDs, stained underwear, and then we may see genital and or anal trauma, painful urination, and then difficulty walking due to the trauma. Another form of child abuse is what we call Munchausen syndrome by proxy. They've changed the terminology and it's now called medical child abuse. And what this is a parent who falsifies or inflicts some type of danger to the child and then they seek medical attention to have it corrected. So this is a kid who's brought in always sick, and it's because the parent is causing it. So the things that you might see is a decreased level of consciousness for whatever reason or however this parent harmed the child. Bleeding, infection, apneic spells. The child may start having seizures and then repeated diarrhea, vomiting, and they may even have dehydration if they're giving them excessive laxatives. And then rash. Shaken baby syndrome is horrendous. I see it way too often. We have a campaign, we have posters, never, never shake your baby, no matter what. Because this picture of this child, age 4 months, on numerous lines to keep him alive as well as a ventilator, that child will never be normal again. Shaken baby syndrome, the physical features we see are retinal hemorrhages, and so you'll prepare this child to have the eyes dilated, and then ophthalmology will come in and look at the retina, and they'll take photos because they take this to court. We'll see brain bleeds because the small vessels are traumatized and they rip and bleed within the brain. This ends up causing seizure activity, or just repeated shaking causes increased intracranial pressure, and that can cause seizures. Eventually, the child will have so much intracranial pressure that it causes a respiratory arrest. It's not just from ICP, but it can also be from a brain bleed. These children can become and stay in a completely vegetative state for the remainder of their life. So these are some of the signs of child abuse and what we're looking for on assessment. This ends part 2.